Hi Taylor, how are you today?
Hi, I'm good. How are you?
Good. Well, I'm Jill again. I'm the occupational therapist.
Okay.
And today I know you've been having a lot of weakness and you've been having some wrist drop in your left forearm and you've been having a lot of problems at home picking up different milk jugs and drinking and eating. So I thought today we could try using neuromuscular electrical stimulation using this unit right here, which is portable, so you could bring it home.
Okay.
And I just thought that would be a great treatment for you today to help strengthen those muscles on the top of your forearm to be able to have you bring your wrist up, because it will force your muscles to contract.
Okay.
And then we'll be able to do some activities with the unit on you.
Okay, perfect.
Does that all sound okay with you today?
That sounds great.
Okay. So in order to use this machine, I just want to make sure that we're not doing this over your carotid sinus. You don't want to do it over the thoracic region. Is there any chance you could be pregnant?
No.
Okay. You wouldn't want to do this anywhere over the uterus.
Okay.
Also, do you have peripheral vascular disease?
No.
Or any vascular complications? No? Okay. And is there, do you have any implantable devices in your heart or in your bladder?
Nope.
Okay. Then it sounds like you'd be a great candidate for this. So I'm going to start with checking your sensation in both arms.
Okay.
So you could put the arms out for me and just close your eyes for me and tell me if it feels the same or if it feels different.
Okay. Same.
Okay.
Same. Same.
Okay, great. And are you currently on any medications?
No.
Okay. And can you tell me where we are right now?
Yes, we're at the University of St. Augustine.
Okay. And can you tell me what year you graduated high school?
Sure, 2011.
Okay, great. And then I'm just going to check this left forearm. Looks like you don't have any cuts. The integrity looks great. So I think you'd be a great candidate. So the first thing we're going to start is we're going to use the alcohol to clean off your skin.
Okay.
So you always want to do this before you use the machine, making sure you get any lotions or any dirt, because that can kind of impede the electrode placement.
Okay.
Okay, so to start off, we are going to place the electrodes on it, and I did include a map in your exercise program, the instructions that you're going to take home with you, so you can see where the electrodes go. But to kind of give you an idea, since we want them on the top of your forearm, you want one of the electrodes kind of right over the muscle belly. So I know you're having problems lifting your wrist right now, but even just trying as much as you can kind of feel a contraction with the bellies of the wrist right here. So we're going to place one of the electrodes right over the belly. And then I also want this wire running down towards your fingers. I don't want it running up.
Okay.
And then you want to place the next electrode in kind of the same position, but you want to make sure there's at least an electrode width between them.
Okay.
Okay, so we want to plug this black one into the top unit. I'm going to make sure those are nice and stuck down. When you're at home, make sure that they're stuck all the way down. You don't want them loose, and if it seems like they're getting a little bit not sticky, you can put some water on it.
Okay.
So you're going to plug this black one into the top one, make sure it's all the way in, and then the red one is going into this bottom one, and then we're going to be doing it in channel 1, so you're going to be plugging this in to the left hand side.
Okay.
Okay, and to start, you're going to press this green power button, and then we're going to have to change the mode, and so you're going to click the mode until you see the EMSS.
Okay.
We're using that one just because we're only doing the muscles on the one side in the one channel. So the mode's set correctly. Next we're going to press set, and the first thing you're going to do is the ramp, which you're going to set to 2 seconds. You can just use the arrows to set it to 2 and press set again. And for the on time, that's how much you're going to be getting that contraction. So it's going to go on for 10 seconds, and then press set again for the off time, and you want to set that to 30 seconds, and that's the relaxing time in between.
Okay.
You're going to press the set again for the rate, which is going to be 30. And then the width, since we're using smaller, kind of smaller muscles here, it's going to be set to 200.
Okay.
Then you're going to use this, it kind of looks like a graph button down here in the bottom right-hand corner, and you're going to click that and set it to asymmetric, again, because it's the smaller muscle groups. Then we're going to set to the timer, and for the time, you want it between 15 and 30 minutes. There is always, I didn't mention this earlier, but there is always a risk that there can be some pain or really intense feelings, but that's really, we really are going to prevent that because you're going to be in control of setting this, and when we're going to be ramping up the intensity of the contraction, you're going to make sure that you tell me when it's strong but comfortable muscle contraction.
Okay.
It's going to be kind of feeling a deep tingling, and your hand's going to actually start to move.
Okay.
So do you have any questions for me before we begin?
No, I think that's all.
Okay, so I'm actually going to give you this bottle. So at first we're just going to push this plus button to start increasing the intensity, and you're going to let me know when it's strong but comfortable muscle contraction, and you'll start to see your wrist actually move on its own. I don't want you to force it. I want you to go with the movement.
Okay.
How are you feeling right now?
Good. I can feel a little bit.
Okay. Is it, would you say strong but comfortable muscle contraction?
No, not yet.
Okay.
Whoa.
Isn't that cool?
Yeah, that's awesome.
Okay, so that looks like a good setting, so you can kind of see where it is here.
Okay.
So it should, when you have that, you remember it's going to be on for 10 seconds and off for 30 seconds. So for this next time, I'm actually going to put this bottle underneath you, and when that 10 seconds goes back on, I actually want you to grip that bottle and bring it up with it, work with that contraction like if you were getting it to drink it.
Okay.
And you can, since your elbow isn't an issue, you could actually move your elbow as well when you're at home, like you're actually going to be drinking that bottle of water. And then on the 30 seconds, we just want you to relax.
Oh, yeah. It's really cool.
So after, I know that 30 minutes, we're almost up now on our time. So when you finish this, when you are at home and it's finished, I do want you to ramp the intensity down before you click the power button off.
Okay.
So we're going to bring this down. And then hit the green power button off.
Okay.
And then we're going to unplug the electrodes, and then we can put them back on our sheet. And there may be some redness, warmness where those are. That's completely normal and will go away in about 30 minutes.
Okay,
and this
great.
is something that you can do up to 2 times a day, 5 days a week.
Okay.
So really great in strengthening those forearm muscles.
Yeah. Okay, great.
Do you have any last questions for me?
No, that was great.
Okay, great. Thank you.